Welcome to the Provider Education Training for Worksheet S-10. This training will provide a brief introduction of Worksheet S-10 Uncompensated Care Bad Debts. We will cover pertinent definitions, regulations, and the flow of the cost report worksheet, as well as what information is to be reported on Worksheet S-10 lines. Additionally, we will address the reporting timeliness of the uncompensated care bad debts and provide the CGS contact information for any further questions throughout the S-10 process. During this training, we will go over definitions, regulations, reporting timeliness, Factor 3, lines 1, 20, 22, 25, 26, 27, and 2701, as well as lines 28 through 31. We will also go over the calculations and the flow of Worksheet S-10. First up, definitions. Uncompensated care consists of charity care, non-Medicare bad debt, and non-reimbursable Medicare bad debt. Uncompensated care does not include courtesy allowances, discounts given to patients that do not meet the hospital's charity care policy, or discounts given to uninsured patients that do not meet the hospital's FAP or bad debt reimbursed by Medicare. Charity care and uninsured discounts result from a hospital's policy to provide all or a portion of services free of charge to patients who meet the hospital's charity care policy or FAP. Charity care and uninsured discounts can include full or partial discounts. If a patient is not eligible for discounts under the hospital's charity care policy or FAP, then any discounts or reductions given to the standard managed care rate must not be accounted for as charity care or an uninsured discount. Discounts given to patients for prompt payment must not be included as charity care. For Medicare purposes, charity care is not reimbursable, and unpaid amounts associated with charity care are not considered as an allowable Medicare bad debt. A hospital cannot claim as charity care amounts of unpaid deductibles and coinsurance for which it has received reimbursement from Medicare. A non-Medicare bad debt includes charges for health services for which a hospital determines the non-Medicare patient has a financial responsibility to pay, but the non-Medicare patient does not pay. These amounts are subject to the cost-to-charge ratio. For a Medicare bad debt, when furnishing services to a Medicare beneficiary, a provider incurs costs in furnishing such covered services. A Medicare beneficiary may be responsible for paying a share of those costs as a part of their applicable deductible and/or coinsurance amounts. When a Medicare beneficiary or other responsible party fails to pay the deductible or coinsurance amounts, the provider has incurred costs of furnishing services that are unrecovered. If the unpaid deductible and coinsurance amounts meet the criteria of 42 CFR 413.89, then these amounts may be allowable as Medicare bad debt. Amounts reimbursed as Medicare bad debt cannot be claimed as charity care. A non-reimbursable Medicare bad debt is the amount of allowable Medicare coinsurance and deductibles considered to be uncollectible but are not reimbursed by Medicare under the requirements of 42 CFR 413.89H and CMS Publication 15-1, Chapter 3. Net revenue includes the actual payments received or expected to be received from a payer, including coinsurance payments from the patient for services delivered during this cost reporting period. Net revenue will typically be charges less contractual allowance. Public programs include federal, state, and/or local government programs paying in full or in part for health care. Next, we will go over the regulations that apply to Worksheet S-10. Section 112B of the Balanced Budget Refinement Act requires that short-term acute care hospitals submit cost reports containing data on the cost incurred by the hospital for providing inpatient and outpatient hospital services for which the hospital is not compensated. Charity care charge data, as referenced in Section 4102 of American Recovery and Reinvestment Act of 2009, may be used to calculate the EHR technology incentive payments made to hospitals and CAUS. Section 1886 N6B of the Act, as added by Section 602 of Consolidated Appropriations Act 2016, adds subsection D, Puerto Rico hospitals as eligible hospitals under the EHR incentive program. In addition, Section 1886 R2 of the Act, as added by Section 3133 of the ACA, requires an additional payment for uncompensated care for 1886D DISH eligible hospitals. Charity care charge data, discounts given to uninsured patients that meet the hospital's financial assistance policy, uninsured discount policy, non-Medicare bad debt, and non-reimbursed Medicare bad debt may be used in the calculation of the uncompensated care payment. Section 1886D hospitals and CAUS are required to complete this worksheet. Next, we will be going over Factor 3 and how that applies to the S-10 worksheet. What cost report elements does DISH UCP Factor 3 use? CMS has stated in various federal registers that they will be using Worksheet S-10 line 30 in calculating the DISH UCP Factor 3. This line 30 is the sum of two separate elements. Line 23, the cost of charity care, plus line 29, the cost of non-Medicare and non-reimbursable Medicare bad debt expense. Combined, these two elements make up an uncompensated care amount. Line 23, the cost of charity care, is impacted by three separate inputs on Worksheet S-10. Line 20, charity care charges and uninsured discounts for the entire facility. This is both columns 1 and 2. Line 22, payments received from patients for amounts previously written off as charity care. And line 21 may be reduced by line 25 charges for patient days beyond the indigent care program's length of stay limit if the provider includes Y on line 24. Line 29, the cost of non-Medicare and non-reimbursable Medicare bad debt expense, is impacted by one input on Worksheet S-10 in addition to all of the Medicare bad debt amounts reported on each settlement worksheet. This is line 26, total bad debt expense for the entire hospital complex. When will the S-10 data be used for the DISH UCP Factor 3? The federal fiscal year 2018 DISH UCP Factor 3 will be the first to incorporate S-10 data. It will incorporate an average of three elements: the 2014 S-10 data and alternative data from the 2012 and 2013 cost reports. The federal fiscal year 2019 DISH UCP Factor 3 will use an average of 2014 and 2015 S-10 data along with alternative data from the 2013 cost report. The federal fiscal year 2020 DISH UCP Factor 3 will use S-10 data from the 2015 cost report. The federal fiscal year 2021 DISH UCP Factor 3 will use S-10 data from the 2017 cost report. The use of further DISH UCP factors will be dependent on CMS's issuance of the proposed and final IPPS rules.
Line 1, cost to charge ratio. Enter on line 1 the cost to charge ratio resulting from Worksheet C, Part 1, line 202, column 3, divided by Worksheet C, Part 1, line 202, column 8. For all-inclusive rate, no charge structure providers, enter your ratio as calculated in accordance with CMS Publication 15-1, Chapter 22, Section 2208. Line 20, charity care charges and uninsured discounts for the entire facility. Line 20, for cost reporting periods beginning on or after October 1st, 2016. Enter the actual charge amounts for the entire facility, except physician and other professional services, of uninsured patients who were given full or partial discounts that were 1. Determined in accordance with the hospital's charity care criteria, policy, or FAP, and 2. Written off during this cost reporting period, regardless of when these services were provided. Do not include charges for patients given courtesy discounts or charges for uninsured patients with or without full or partial discounts who do not meet the hospital's charity care criteria or FAP. Charges for non-covered services provided to patients eligible for Medicaid or other indigent care programs, including charges for days exceeding a length of stay limit, can be included, if such inclusion is specified in the hospital's charity care policy and the patient meets the hospital's charity care criteria. Line 20. Enter in column 1 the total charges or the portion of total charges written off to charity care for uninsured patients and patients with coverage from an entity that does not have a contractual relationship with the provider who meet the hospital's charity care policy or FAP. In addition, enter in column 1 charges for non-covered services provided to patients eligible for Medicaid or other indigent care programs, if such inclusion is specified in the hospital's charity care policy or FAP and the patient meets the hospital's policy criteria. The total charges or portion of total charges is the amount the patient is not responsible for paying. For example, 100% of charges if the patient qualified for a 100% discount, or 70% of charges if the patient qualified for a 70% partial discount. Enter in column 2 the deductible and coinsurance payments required by the payer for insured patients covered by a public program or private insurer with which the provider has a contractual relationship that were written off to charity care. In addition, enter in column 2 the non-covered charges for days exceeding a length of stay limit for patients covered by Medicaid or other indigent care programs if such inclusion is specified in the hospital's charity care policy or FAP and the patient meets the hospital's policy criteria. Do not include in column 2 amounts of deductible and coinsurance claimed as Medicare bad debts. Note: when reporting charity care or uninsured discounts for cost reporting periods beginning on or after October 1st, 2016, amounts a hospital received for charity care charges reported on line 20 of a prior cost reporting period and not reported on line 22 of a prior cost reporting period must be offset on line 22 of the current cost report. Lines 20 and 22 must be completed independently. Do not record on line 20 net charity charges. Line 20 must include all charges and line 22 must include all receipts. Column 3 calculates the sum of columns 1 and 2. Further clarification of line 20. Providers should be splitting claims for patients with covered and non-covered charges noted on their remittances. The determination of being insured is not based on the patient, but based on the charges instead. For an insured patient, including a Medicare beneficiary that has exhausted their benefits or otherwise has a non-covered portion of a claim, any charges that were approved for charity care related to the non-covered service must be reported in line 20, column 1, subject to the CCR. Any charity care approved deductibles and coinsurance related to the covered portion of the claim will be reported on line 20, column 2, not subject to the CCR. Cost reporting instructions state: enter in column 1 the total charges or the portion of total charges written off to charity care for uninsured patients and patients with coverage from an entity that does not have a contractual relationship with the provider who meet the hospital's charity care policy or FAP. All implications in the language point to the fact that full charges are not to be reported for charity for uncompensated care. Insured charges are reduced by the contractual allowance by the insurance plans, and uninsured by the cost to charge ratio. If full charges for non-covered charges for insured patients are reported in column 2 of line 20, they are not netted by contractual adjustments or cost to charge ratios, resulting in full charges being reported for uncompensated care, which would overstate the amounts to be reported. Line 21, cost of patients approved for charity care and uninsured discounts. Line 21, providers should be splitting claims for patients with covered and non-covered charges noted on their remittances. Enter in column 1 the cost of uninsured patients approved for charity care and uninsured discounts by multiplying line 20, column 1, times the cost to charge ratio on line 1. Enter in column 2 the deductibles and coinsurance not subject to the cost to charge ratio on line 1 for insured patients approved for charity care, line 20, column 2, minus line 25, plus the non-covered charges for insured patients for days exceeding a length of stay limit that are subject to the cost to charge ratio on line 1, line 25 multiplied by line 1. Column 2. If the provider indicates yes to line 24, that any charges for patient days beyond a length of stay limit imposed on patients covered by Medicaid or other indigent care program are included in the amount reported on line 20, column 2. HFS will reduce the amount that flows to line 21, column 2 from line 20 by the amount reported on line 25, column 1 times the cost to charge ratio on line 1, which in turn reduces line 23. Line 22. Payments received from patients for amounts previously written off as charity care. Line 22. For cost reporting periods beginning on or after October 1st, 2016, charity care charges or uninsured discounts reported on line 20 include amounts written off with no expectation of payment. Enter all payments received during this cost reporting period regardless of when these services were provided from patients for amounts previously written off on line 20 as charity care or uninsured discounts. Enter such payments for the entire facility except physician or other professional services. Use column 1 for payments received from uninsured patients and patients with coverage from an entity that does not have a contractual relationship with the provider, and use column 2 for payments received from patients covered by a public program or a private insurer with which the provider has a contractual relationship. Do not include grants or other mechanisms of funding for charity care on line 22. Payments entered on this line must not exceed charity care or uninsured discounts written off in the cost reporting period. Do not include payments received that represent a patient's liability or amounts that were not previously written off on line 20 as charity care or uninsured discounts. Line 25. Charges for patient days beyond indigent care programs length of stay limit. Line 25. If you answered yes to question 24, enter charges for patient days beyond a length of stay limit imposed on patients covered by Medicaid or other indigent care program for services delivered during this cost reporting period. The amount must match the amount of such charges included on line 20, column 2. Line 26. Total bad debt expense for the entire hospital complex. Reporting timeliness for uncompensated care bad debts. Reporting timeliness for uncompensated care bad debts. Bad debts for uncompensated care purposes are not subject to the Provider Reimbursement Manual, Chapter 3, which are reportable at the end of the collection cycle when all collection efforts have ceased. Unlike Medicare bad debts, uncompensated care bad debts are to be claimed when they first are determined a bad debt, the beginning of the collection cycle. Uncompensated care bad debts can be recognized when they first go out to collection or when they first hit a bad debt status, whichever method is used in the provider's system. Line 26. Enter the total facility, entire hospital complex amount of bad debts, Medicare bad debts, and non-Medicare bad debts, net of recoveries, written off during this cost reporting period on all balances owed by patients regardless of the date of service, and conclude such bad debts for all services except physician and other professional services. Amounts from line 20 above must not be included here. The amount reported must also include the amounts reported on worksheets E Part A, line 64, E Part B, line 34, E2, line 17, columns 1 and 2, E3, Part 1, line 11, E3, Part 2, line 23, E3, Part 3, line 24, E3, Part 4, line 14, E3, Part 5, line 25, E3, Part 6, line 8, E3, Part 7, line 34, I5, line 5, lines 5.05, column 2, for cost reporting periods that overlap or begin on or after January 1st, 2011. Worksheet J3, line 21, Worksheet M3, line 23, and Worksheet M4, line 9. For privately insured patients, do not include bad debts that were the obligation of the insurer rather than the patient. Lines 27 and 27.01, Medicare reimbursable and allowable bad debts for the entire hospital complex. Line 27, enter the total facility, including the entire hospital complex, as well as farm demonstration, Medicare reimbursable, also referred to as adjusted bad debts, pursuant to 42 CFR 413.89H, as the sum of the worksheets E Part A, line 65, E Part B, line 35, E2, line 17, columns 1 and 2, line 17.01, column 1 and 2, for cost reporting periods that begin on or after October 1st, 2012. E3, Part 1, lines 12, E3, Part 2, line 24, E3, Part 3, line 25, E3, Part 4, line 15, E3, Part 5, line 26, E3, Part 6, line 10, I5, line 11, J3, line 21, line 22 for cost reporting periods that begin on or after October 1st, 2012. M3, line 23, line 23.01 for cost reporting periods that begin on or after October 1st, 2012, and N4, line 10. Line 27.01, enter the total facility, the entire hospital complex, including farm administration, Medicare allowable bad debts, as the sum of worksheets E Part A, line 64, E Part B, line 34, E2, line 17, columns 1 and 2, E3, Part 1, line 11, E3, Part 2, lines 23, E3, Part 3, line 24, E3, Part 4, line 14, E3, Part 5, line 25, E3, Part 6, line 8, I5, line 5.05, columns 2, J3, line 21, M3, line 23, and N4, line 9. The amount entered on this line must also be included on line 26. Lines 28 through 31. Lines 28 through 31. Line 28. Effective for cost reporting periods beginning before October 1st, 2013. Calculate the non-Medicare bad debt expense by subtracting lines 27 from line 26. Effective for cost reporting periods beginning on or after October 1st, 2013. Calculate the non-Medicare bad debt expense by subtracting line 27.01 from line 26. Line 29. Calculate the cost of non-Medicare and non-reimbursable Medicare bad debt expense. For cost reporting periods beginning on or after October 1st, 2013, the cost of non-Medicare bad debt expense is calculated by multiplying line 28 by the cost to charge ratio on line 1. The cost of non-reimbursable Medicare bad debt expense is calculated by subtracting line 27 from line 27.01. This amount is not multiplied by the cost to charge ratio on line 1. Enter the sum of the non-Medicare bad debt expense and the non-reimbursable Medicare bad debt expense. Line 30. Calculate the cost of uncompensated care by entering the sum of lines 23, column 3, and line 29. Line 31. Calculate the cost of unreimbursed and uncompensated care by entering the sums of line 19 and line 30. S-10 questions. If any of the providers have any questions regarding the S-10 topics covered here or anything to do with their S-10 information, contact CGS administrators at s10units@cgsadmin.com. Thank you.